Swadikap, and good afternoon once again. Today is Wednesday, the 25th of August, 2021, and this is the English language summary of the daily press briefing here at the CCSA as always. So thank you to Dr. Pisamai. She highlighted very important issues. I'll just go through some of those, as well as information that might be useful and of interest to the English language audience. First of all, Thailand ranks now at number 32 globally in terms of the number of people being infected with COVID-19. Dr. Pisamai also mentioned that increasingly now we have information about imported cases into various provinces, imported not from foreign countries, but from within and between provinces in Thailand itself. For example, imported because people have been traveling to the provinces from the dark red zones to the red zones or the yellow zones. So therefore, the number of imported cases into particular provinces have remained a challenge. Dr. Pisamai also talked about the supply of vaccine, that of course in terms of the supply will be forthcoming in the months ahead, be it AstraZeneca or Pfizer, towards the fourth quarter of this year. The supply of vaccines is very important for our national vaccination program, which we inoculate on an average of around 500,000 shots or vaccines per day, with the goal of around 15 million vaccination shots inoculated per month. So 500,000 per day and 15 million per month. So that is our goal, which we are on track and hoping that the national vaccine campaign will reach its goal of 100 million doses by the end of this year. For the general situation and numbers that we have for today, we recorded 18,417 cases, and we will have a infographic on screen for you there. It's in the blue box on the left. As compared to the new recoveries recorded for today, we have 21,186. So therefore, it's been a trend in the past days and week already that the number of new confirmed cases is not as high as the number of new recoveries. We have active cases still currently being treated at now lower than 200,000. If you recall, in the past week, it was over 200,000. Those who have been discharged or cured already have gone home. And we have now over 189,000, hoping the number will decline in due course. Now, for the new fatalities, we record 297. This has been on a growing trend in terms of above 200, almost 300, or above 300 for the past few days. The accumulated total of fatalities is over 10,000 now in Thailand since the very beginning, or the percentage rate of death rate in Thailand now stands at 0.91%. If you recall, it was around 0.8% in the past months. Now it's 0.91%. In terms of the new confirmed case that I mentioned, over 18,000, we have a large number, around over 15,000 of these who were found to be infected from hospital walk-ins, meaning that they suspect that they were infected and they walked into hospitals and then they were treated for COVID. Around 2,300 plus were found to be infected after active case findings. So now let's look at the latest figures in terms of the inoculation drive. Yesterday, we had a total of over 585,000 doses of vaccines administered, with around over 400,000 doses having received their first jab, and around 175,000, over 175,000 receiving their second dose, and over 9,000 their third dose, usually reserved for medical professionals and frontline workers. Now, the aggregate total of vaccines administered so far now in Thailand stands roughly at 28.2 million doses, over 28 million doses. And as always, these figures are inclusive of the members of the expatriate communities in Thailand. And you have some figures there up on screen for you. Dr. Apisamai also mentioned about the vaccination schemes for pregnant women who are encouraged to receive the jabs. Now, the statistics collected by the Department of Disease Control shows that between the month of December of last year to the 13th of August, a week ago, 2021, pregnant women who had contracted COVID have a 1.85% fatality rate, or roughly 2.5 times higher than the normal person, while the fatality rate for babies, both born and unborn, stands at 1.8%. The mother-to-child infection is at 11%, both during pregnancy and postpartum contact. So as we are trying our best to reduce the number of fatalities by prioritizing various groups, those over 60, those who have the 7 pre-existing medical conditions, and those who are pregnant women who are over 12 weeks pregnant, the Bangkok Metropolitan Administration has opened 12 vaccination centers in Bangkok where pregnant women can receive the vaccines without pre-registration starting from today, the 25th of August. The vaccination centers, and you have a list there, I believe, on screen for you in English, courtesy of an infographic from the Public Relations Department. And for pregnant women going into this scheme for vaccination, please bring your antenatal care documents and records along with the identification forms and to the vaccination center. And more information, the hotline is 1516. On Expat Vac, the vaccination scheme from the collaboration of the Ministry of Foreign Affairs and the Ministry of Public Health, as you know, the infographic on screen for you is that registration. The Foreign Ministry, working in close contact with the Department of Disease Control and the embassies and consulates in Thailand, to proceed with the appointment making of this scheme, this inoculation drive for the expat community in Thailand. And this is expatvac.consular.go.th. Now, we are aware that some of the people who have registered have encountered some technical difficulties due to the high number of demand that has put a strain on the system. However, we know that, of course, for those who have received appointment dates already, that's a large number already from those who have registered. So those who would like to follow up with your registration or queries, for those who have not been contacted back yet, any queries regarding technical difficulties, you can email the administration, the admin of this page, which is on screen, foreignvac@gmail.com. Once again, foreignvac@gmail.com. And please kindly note that this email channel should only be used for appointment follow-ups and queries regarding technical errors of the expat vac system. Another good piece of information for the foreign community or the English language audience here is about the digital vaccine certificate for non-Thai nationals. Those who require a digital vaccine certificate after receiving their first dose can now do so by downloading it directly from the Moprom application, simply by registering themselves on the app. So here is how it works. First, find the 13-digit ID number assigned to you on the COVID vaccine appointment card issued by the Ministry of Public Health. Then find the Moprom application on the App Store or Google Play, and choose Create Account to fill in the ID number and your phone number. And after receiving the SMS for the OTP, you will be automatically logged into the Moprom application after authentication. Tap on the right-hand corner icon that says COVID vaccination history, and the proof of your vaccination type and date of inoculation will be shown on the screen. This can be used as proof of vaccination necessary for domestic travel in Thailand, and other types of official proof of vaccination as recognized by the Thai government. Just to stress, it's for domestic use in Thailand. And please note that this is currently working on the application itself and not on the line application of MOPROM. And credit to the people who have assembled this information and infographics. Another information which might be of interest is that Thailand could possibly be the first ASEAN country to produce the COVID vaccines. In the beginning, Dr. Apisamai and just now myself, we mentioned about the supply of vaccines, be it AstraZeneca or Pfizer, that are forthcoming towards the fourth quarter of this year. Now, for those that have been following the news about the locally produced vaccines, here's some updates. As a boost to the government's determination to procure more vaccines, the ongoing clinical trials of locally made vaccines have also made steady progress. And if proven successful, Thailand is slated to become the first ASEAN member state, to produce its own vaccine, as several laboratories have been successful in conducting the research and clinical trials of their own COVID vaccines. With the COVID-19 vaccine developed by a team of doctors and scientists from the Chulalongkorn University being the most advanced project to date. The COVID-19 vaccine has now entered the third phase of clinical trials, and the research team is hoping that by the end of this year or early next year, the country will be able to start producing its own doses of an effective vaccine. For those who have been following about the Phuket sandbox extension, if you recall, 7+7 scheme of the Phuket sandbox, that has been progressing quite well. And as of yesterday, we have 3,578 tourists who had left Phuket by land for the extension areas, meaning another +7 days of quarantine in other provinces. That would be in Krabi, such as in Got PP and Got Raile, in Phang province, as in Khao Lak and Got Yao. Also from Phuket to Surat Thani province, such as Samui Island, Got Phangan, and Got Tao. So after 7 days in these extension areas, the international visitors may proceed to other provinces. This is the 7+7 scheme, Phuket +7. And the next destinations slated to be included, next destinations that would be included in this 7+7 scheme would include, possibly in the future, Bangkok, Surat Thani, Prachuap Khiri Khan provinces, as well as Chiang Mai and Chonburi provinces, which have complied with the pandemic controls required by the CCSA. And in total, a total of 22,000, over 22,000, to be exact, 22,810 tourists had arrived under the Phuket Sandbox scheme already to date. And a total of over 409,000 nights of rooms, room booking nights, have been made from July up until September next month. Over 400,000 room nights, bringing in over 24,000 tourists on 288 flights. The daily flights continue to bring in tourists, and 5 primary countries of origin that have arrived in the Phuket Sandbox scheme have included the United States, United Kingdom, Israel, France, Canada, and Germany, as well as other countries. So just some points before I end. I'd just like to talk a little bit about empathy and about caring for each other, of course. We talked about that a lot last year. This year, this feeling of community still continues. And this includes Thai people helping each other. And I'm sure this sentiment includes about foreign nationals and Thai people as well. So you have on screen there, which was displayed during the Thai language briefing just now by Dr. Apisamai as well, about the center in which Thai people have begun to help each other in various ways and means. Now, this particular is just one example in cooperation between the NBT news station as well as Nakhon Si Thammarat province and Bangkok as well. And this is providing necessities, particularly food, for those in need in this time of despair. And just to end, I'd just like to talk a little bit about what the Ministry of Public Health has been talking about in terms of the Delta variant of COVID-19, that it can spread as fast as chickenpox. So it's very necessary to continue to observe the important public health measures, or what we have dubbed the universal prevention. I'll put that in capital U, universal, and capital P, prevention, including social distancing, mask wearing, including when you are at home and with other family members, and washing hands frequently. And infographic on screen there about the Delta COVID variant, which can spread as fast as chickenpox, and the universal prevention measures which we stress to you every day, courtesy from that infographic from the Public Relations Department. And with that note, I thank you very much for your attention, and we'll have the next English language briefing at the CCSA next time on Friday. Thank you and see you then. สวัสดีครับ